India's first institutionalized home healthcare company. We are in 4 cities: Chennai, Bangalore, Trivandrum, and Mumbai. We have around a group of around 1,500 nurses across these 4 cities, serving patients day in and day out. We started this to provide quality home care for the patients who are in need. People need not be in the hospital after the surgery. They be discharged, so the hospital can serve the another needy patient. Most of the hospitals, always they are full. They are not able to admit a new patient because there is no vacancy. We are able to help the hospital discharge the patient earlier. And for the patient, they don't need to disturb their sons or daughters or daughter-in-laws. They can go to their work. We take care of them, and the cost is significantly less. And the third is hospital, more they stay, they get secondary infection. This lab, we set it up actually with the aim, because our nurses at home are the first respondent in terms of heart attack. A patient gets heart attack, any condition actually, suddenly they develop. In hospital, they have a lot of help. They have doctors and everybody. At home, they don't have anybody. So we thought that we should invest actually good amount of money with the help of our equity partner, Mr. Mark Baida from US. What do you call like Baida? Mark, please. We set up this. We set up this ICU Simulation Lab. Baida is a world leader with 42 years of experience in this industry, more than $1.3 billion in revenue with 30,000 plus nurses. Mark is the founder. And he has been striving to serve millions of people worldwide over the last 40 years. Here is Mark.
Good. Yeah.
Sir, how are you feeling?
Pardon me?
How are you feeling?
How are you feeling?
I'm feeling very happy that they're able to bring the simulation technology to Bangalore. So we've been doing this for years, and it's very well established in medical schools, nursing schools, and we have it at every one of our locations. And we're happy to now bring this technology here to train the nurse to a higher level, because the patient conditions at home now are they're more medically fragile, and the nurse has to be trained to respond properly if there's an emergency, just like you get a response in a hospital. Mm-hmm.
And to help the patients serve the right way, we hired Dr. Naveen. Dr. Naveen is a doctor, studied his based by MBBS here and did his master's in US and worked in the training and simulation labs for several years in US. We hired him to make sure actually he is able to train our nurses so that they were able to quality service at home. Here is Dr. Naveen.
Sure. Hello. Hi. So like our chairman had said, this is probably one of the first simulation centers for a home healthcare based company. And the reason again why we spend so much money on this is to make sure that our staff are well prepared to handle any emergency that happens at home. Like our chairman had said, in a hospital, you have a whole team helping you with, manage your situation. Whereas at home, you're by yourself. And all the patient parties and, patient bystanders, they look up to you for help. So you have to be confident. So that's why we have the simulation lab as to how the simulation works. So this is a situation where we have a patient who is undergoing critical care services. So this patient has difficulty in breathing, and that's why they have a tracheostomy that is done. And this patient is also connected to a ventilator. Now, ventilator is like an artificial lung, which helps you, assist you with the breathing and respiration when you cannot breathe on your own. And so we're going to simulate a situation where this entire thing has come out, and then suddenly, the nurse has to respond to it. The alarms go out, and how we do that. So let's take you through that. Let's setting up the scene.
Okay, sir.
Scene setup.
A ventilator back to the patient.
Hello, doctor. We have an emergency. So please come to this.
Now he is started to breathe.